Good afternoon, everyone. I am Pam Schaff, and I'm the director of Keck School of Medicine's Humanities, Ethics, Art, and Law, or HEAL program. We're really excited about today's event, which will feature the work of our artist patient for today, Laura Ferguson. And I'm going to let Ted Meyer introduce her. I want to first say that this program continues our mission, HEAL's mission, to align the work of patient artists with the core medical school curriculum and to foster enhanced understanding between patients and future healthcare professionals. We're really excited to have Dr. Mark Spoonamore here to be our discussant with Laura and with Ted. Dr. Spoonamore is Associate Professor of Clinical Orthopedic Surgery. And as many of you who have been here before know, Ted Meyer is our artist in residence. And we are very grateful to him for bringing us these programs. So Ted, I'm going to let you take over.
Okay, thank you. Well, I'd like to introduce Laura to you. And Laura is actually the reason I am here today and the reason you are all here, because Laura is the artist in residence at NYU Medical School. And we'd been in a show together a long time ago, I believe at the United Nations. I'm not even sure where we first met. And the idea had never occurred to me at the time that an artist would fit into the medical school. So everything that's happening here today is because of Laura's work in New York. So Laura is a scoliosis patient. She does work about her spine and her body, and we're going to look at some of that in just a moment. So I'm going to call up my screen. So I always start with a couple facts, and I was sort of surprised by some of these. So I didn't really realize the percentage of scoliosis patients. It's 2 to 3% of the population. So that's 7 million people in the States. And I always bring these numbers up so when you are picking your specialty, you'll know whether or not you'll be able to make a living at it. 29,000 surgeries a year on adolescents for scoliosis. The cost $92,000 as opposed to an average stay of $17,000 for a regular person. 74,000 emergency room visits by adults with scoliosis. Twice as many adults with scoliosis report continuous back pain as non. And also one that Laura and I will talk about later, scoliosis patients have a higher percentage of thinking about suicide. And I got all these from sort of a scoliosis, 2 different scoliosis websites. So we'll talk about that later. But first, we're going to start with Laura's x-rays. And let's start with this one. This sort of shows the condition of your back. And let's talk about not only your medical condition, which you can go into, but then talk about the artistic history, where this x-ray fits into your canon of artwork.
Absolutely. So my scoliosis was diagnosed when I was about 8 or 9, and by the time I was 13, it had gotten so advanced that they told my parents I needed to have surgery. And I had a spinal fusion with bone graft, which was this was in 1961. That was probably the last time those particular surgeries were ever done. After that, they started using rods, and they would do the fusion by attaching screws to the vertebrae and metal rods that would hold it in place, and then you could get up and walk around the next day, basically. But with a bone graft, you had to give the bone time to heal. So I had to be in a huge body cast for about a year after that. And it was a pretty horrible experience, as you can imagine. I had my interactions with doctors at the time that, kind of had a big effect on my future relationships with doctors, and my probably turning to making art as a way of dealing with that. I was 13. I felt like I was just on the verge of being very grown up, and they treated me just like a child. And they were very, they thought it was best for the patients not to know too much about what was going on. So they didn't tell us anything. They didn't tell us when our surgeries were going to be or what the next step was going to be or anything. I found that, it was hard enough to sort of lose control and be in this situation where all these things are being done to you. And then on top of all that, to have doctors kind of not acknowledge that and treat you like a child and not let you be part of the process, really made it worse. So that's something that I've thought about a lot, you know, as an artist later, and especially when I came to be teaching anatomy drawing to medical students, you know, to really try to see if I could make that part of the process, make people think about that a little bit more. You know, I just think it's better to acknowledge these issues and bring them up right at the beginning, you know. Anyway, I'm digressing a little bit. I had the surgery. I was fine after that, or I thought I was completely cured, you know, for about 20 years. And then in my early 30s, I started to have back pain, really bad back pain. And, you know, it was hard to walk. And I was a young mother at that point. And so, you know, I started going to orthopedic surgeons again, and they all told me that I needed to have more surgery, but I would have the rest of my spine fused. And by the way, I should have gone into more detail. I had the fusion I had when I was 13 was T 5 through 12, so the thoracic vertebrae 5 through 12 with bone graft, and that's what you can see, you know, in the thoracic curve of my spine. In the X-ray, that's basically just a solid mass now, and you know, each of the vertebral bodies looks basically as it did before the surgery, but all the bone graft was placed into the spinous processes in the back. So that's where, you know, if you saw the X-ray, you know, in better detail, you would see like just like a big fuzzy kind of mass in the back, you know. And then my lumbar spine, though, was not fused, and that's where I started having all the pain later because all the pressure of gravity was coming down. There was no more shock absorbers in my thoracic spine, so all the pressure of gravity was coming down on the lumbar, and it started becoming very arthritic, and you know, bone spurs and all kinds of spinal stenosis and every kind of problem you can imagine in the lumbar spine. So that's when I started having back pain again, and I was told I needed to have more surgery. But I really hated the idea of having the whole of my spine fused, or the loss of movement that would, you know, that would come along with that. And then just the idea of having those metal rods in me, which I had, you know, I'd had to go through the year in a cast to not have the first time around. I would have been happy to avoid that, but I hated the idea of just having to go around the rest of my life with these metal rods in my back. So I decided to try to see if I could find some other ways to avoid having surgery. And I ended up doing various kinds of body work, starting with Alexander technique, you know, which is kind of a breathing and alignment technique where you learn to do the movements of daily life with more, you know, with better alignment of your spine, and to create space, even to create space between your vertebrae. And that really helped a lot up to a point. And then I started working with someone that was doing a more sort of customized work called neuromuscular training, where she worked with me specifically, you know, individually, and we worked on different exercises that would help me to take pressure off the different, you know, to balance out the muscles on one side of my spine had gotten very weak and the others strong, but always, you know, having to contract to hold me up. And so we worked on trying to even those out. And it was through that I just started getting very interested in anatomy. I had never really thought about what my spine even looked like. I had, you know, never really been interested in it once my surgery was over. But my neuromuscular trainer had a real human skeleton that she used for teaching. She was a teacher of dance anatomy. And she started showing me, you know, on the skeleton how a normal spine looked and how, you know, what was happening with mine. And I began to understand how three-dimensional it was, instead of just being a side-to-side curvature, which is what it's known as. You know, it's defined as a lateral curvature of the spine, but it's actually three-dimensional because the whole rib cage rotates. Then the compensating curve, which in my case is the lumbar, you know, has to rotate the opposite way to try to balance it out. And I started getting really fascinated by the whole thing. And my neuromuscular trainer, dance anatomist, who was helping me, she invited me to come in and draw from her skeleton. And we started having these weekly drawing sessions, like life drawing from a model, only we were drawing from the skeleton. We would, you know, lay it out on her table and pose it and draw it from different angles. And I just completely fell in love with the skeleton and decided to start seeing if I could make some drawings from my own x-rays, and to try to take this very flat image and kind of three-dimensionalize it and figure out what my own spine would look like. So that was it.
So I was going to take a break here before we get into talking about this piece as an art piece. So if our doctor could chime in here. So looking at her x-ray, how does this look, you know, compared to other people that come into you? Maybe you could talk about a little bit for all our med students here. If somebody came into you with this X-ray and some pain and what was going on with Laura, what would you think?
Well, it is a, you know, pretty significant curvature. It is, as you said, it's a condition that affects a lot of people, females more than males, actually, by a significant amount. And it usually happens in early adolescence if it's going to happen. So it's tough because it's kind of it's a deforming musculoskeletal condition that happens to young females at a very delicate age. So it's as I've come in my practice, the psychological, psychosocial aspects of it need to come into your understanding as a doctor too, because you're not just treating the spinal curvature, it's the whole patient. So the point is well taken to what Laura said. I mean, ever since I've been in med school, and even before that, I've been, you know, really interested in orthopedics, and it's not just a spinal column, it's a whole person that you're treating. So it is pretty significant, and it's kind of two categories of patients. One where the curvature isn't very significant, it's curved, but it's not that bad, and it ends up having a very good prognosis and doesn't need surgery. The problem is there's a smaller percentage that do need surgery, and certainly at the time Laura had the surgery, that's just the best technology that we had at the time. And so, and I'm sure they told her or her parents that, you know, the risk if you don't have it is it keeps curving and can be so severe that it starts to really encroach your rib cage and cardiac have cardiac dysfunction, other things. So that was the big fear when you have a pretty significant curve at that point. And as you can see, it's mainly in the thoracic region for the curve.
So since it's mostly women, I'll ask, does it affect childbirth?
It generally doesn't, because it's usually located more in the thoracic area and thoracolumbar. So it's possible that it could, if it really had a major effect in the lumbosacral, but it usually doesn't. So it actually doesn't have that effect. And one of the big research projects that I've worked on, I worked with Stuart Weinstein, who's, you know, another nationally or internationally renowned scoliosis specialist. We published a 50-year follow-up study, and one of the interesting aspects of it is all of the for the patients, you'd think there would be this big difference in terms of all the psychological and social and economic and occupational aspects, and really the differences weren't actually nearly what you'd expect. I mean, everything is equal in a population without scoliosis, except, as you touched on, there are some psychological aspects of it. But people went on and had the same percentage, went on and had families, had children, had, you know, laborious jobs, non-laborious jobs. All of those statistics were equal. But there is some psychological parameters where, like you touched on, that where there's more of a self-image problem, some other things. But if you really look at it, we didn't, in our data, we didn't actually see, even though there may have been some suicidal ideation, the statistics for suicide or any type of major psychological dysfunction is actually pretty cool.
That's good, because when Laura and I was going over all these things with her the other day, and I got to that number and she's like, what? That doesn't make any sense. So Laura, let's go back to this picture and talk about it as an art piece. How did this land up being your first art piece on this?
This is an X-ray. It's not really an art piece, but it
Oh,
was,
I'm sorry.
difference was, this was the first X-ray that I had, not as a patient, but as an artist. So I had been started by just working from X-rays that I had from my own orthopedic visits. But I decided that once I got more seriously into my project of investigating my own, doing an investigation of my own anatomy, that I needed an X-ray that was more, where the visual qualities were more important than the diagnostic qualities, let's say, and where I would have more control over it. It would be just for the purpose of art. So I managed to find an orthopedic surgeon in New York that was willing to work with me, and he, I guess, prescribed the X-ray for me from his radiology lab. And I got to be in charge basically. So, the first thing they always make you do is take off all your metal jewelry, but I insisted I was keeping my earrings and my gold chain on, the same one that I'm still wearing today. I guess you can't see me right now, but that felt very triumphant to me. And every time I look at the X-ray and all the drawings I made from it, I always think about that. And it wasn't just to feel in control or to feel triumphant, but it was also because I was going to use the earrings to sort of be able to check my balance, and the gold chain, I kind of fixed it so the clasp would be right in the midpoint in the back, and I kind of pulled it in the front where I thought the midpoint was. And then I was shocked when I actually saw the X-ray, because this was after years of doing Alexander technique and neuromuscular training, and I thought I was so perfectly aligned, but instead I saw my head sort of tilting to the right, and my gold chain was nowhere near the midpoint. So I think there are some inherent proprioceptive issues that a lot of people with scoliosis apparently have, and some people even think that could be a cause of why the spine gets into this curving pattern. But I thought it was really interesting. Anyway, this X-ray just became the source, one of the anatomical resources that I used to make a lot of my earlier drawings.
So let's talk about this one. So you had talked about the 3D aspect of everything being out of alignment. So how did you land up in a 3D imager?
Right. So just to talk about the X-ray for one more minute, and then I forget what the point I was going to make. But anyway, yeah, I did, there's nothing less three-dimensional than X-ray, basically. It flattens everything out into really, you don't even have a sense. There's no shading or anything. There's no sense of three-dimensionality. So you have to figure it all out from, if I was looking at a human skeleton, let's say, and trying to figure out where the three-dimensionality of my vertebrae were, it was really, really complicated. So, and also, it was always in this one standing pose, which of course I wanted to draw my figure from more interesting angles, and it was just too complicated to figure out, where my rib cage would be and how the curvature of my spine would look from, a profile view or a three-quarter view or something. So I started asking around to try to find out about, imaging technologies that were available that might have a 3D aspect. And I was lucky enough to connect with this Dr. Andrew Litt at NYU Medical Center, who was using the first 3D CT scan, spiral CT scans. And I think probably because they were just still in the process of testing them out and seeing what they could do, when I asked if I could have one, they decided it would be a good opportunity for them as well as for me. So they allowed me to come in and have the scan. This was in 2000, by the way. And the thing I meant to say about the X-ray too was that was in 1995. So it was a long time ago. That was already, in terms of how severe my curvature was, that was already after I had had the fusion, of course. So it was a lot worse before that. And it's probably gotten worse since then, not the thoracic, because that's all fused, but my lumbar has gotten a lot worse since then. But the 3D scan, yeah, I got to have the scan in 2000, and then in 2008, because I kept in touch with Dr. Litt and his staff, the technology had gotten even better, and they let me have a second scan, which was, the quality of detail was incredible. That's what you're seeing right now. So this, I could actually, work on their computers. They would let me come in and help me. It was really fantastic. And I could manipulate it around, move it around, and look at it from any angle. Of course, I was just lying down on the table when it was taken in the first place. So, there are limits to what I could do in terms of using it to match a pose figure pose that I wanted to draw later. But I would have to maybe use an image of the rib cage for part of the pose, and then the pelvis for another, and figure out myself, where the scapula would be, and where, where the moving parts would have moved to if I was drawing myself bending or, from a different angle or something. But it was really, really fascinating. And I think, the whole issue of three-dimensionality, I mean, I think for me, for years, even after I had my surgery, I kind of thought of my spine almost as if it was flat, that idea of the lateral curve, and just a certain, I guess, dissociation that I was, maybe as some kind of defense mechanism I was having, just made me think of it as sort of flat while the rest of my body was three-dimensional, obviously. And, I couldn't really see my back. None of us can. So that, it just kind of never seemed totally part of me. And I think my drawing project, coming to know myself through drawing, had a lot to do with just coming to feel three-dimensional and, learning to draw my body so that it looked three-dimensional, which is difficult. And in the process, coming to feel more three-dimensional myself so that it all became part of a whole. And it's been really wonderful and really has done that for me.
So Dr. Spoonamore, do you use 3D imaging now a lot, or are you still sticking to x-rays? Someone comes into you, what do you do?
Well, we were using it a lot more. Nowadays, we don't usually do it for every patient because we're more conscious about radiation, especially in a younger person. So if we think there's some kind of bony abnormality that we really need the fine detail for, that we can't see well enough on the x-ray, we might do it, but it's not generally done for every patient for that reason. I mean, I think when we first started getting the 3D CTs, like Laura said, it was pretty interesting. We liked it, but then, the negative is that there is increased radiation. So we're trying to there's a real push to be very conscientious about that.
Yeah, I should say, I had the same, when I had the second CT scan, it was definitely, I had to really think about the risk of all the radiation. And then, I decided that was it. I was never going to have any more, because it is a lot, it's the equivalent of many, many x-rays.
So Laura, let's talk about this one where I'm assuming this is some of the images from the CT scan in with your artwork.
Yes, I made this drawing. I think I might have started it when I just had the x-rays, but I had the CT scan in 2000. No, I had this sorry, I had the CT scan in 2000 and then made this drawing because this ended up being in that show that we were both in, where we first met, and that was in 2004. So yeah, so this one really helped me. And even though it seems like it's looking straight from the back, it's actually a kind of slightly turned and definitely, somewhat bending view. So all the issues that I was talking about before, I had to really figure out, looking at my 3D scan, I could turn it slightly, and then I had to maybe use a different image of the rib cage, a different position for the pelvis, and then figure out myself where my scapulae would have been with my arms in that position, and all those interesting issues about the.
So when you show this, do lots of people come up and tell you about their back pain?
Yes, I've had a lot of interesting reactions to it. I mean, a lot of people, more than anything else, a lot of people with scoliosis tell me that they're just so thrilled or moved to see an image of a curving spine that's actually beautiful instead of ugly. And I think, if there are psychological issues, it has to do with the sense that our society gives us that, having any kind of unusual anatomy or deformity is bad and, just so unattractive. And even the word ugly even appeared in lots of medical literature that I read when I was first starting to work on my project. I don't know if that would still be the case, but, I was kind of shocked to hear that. And I think there's just an implication that maybe even one of the reasons for surgery is for cosmetic reasons. May not be stated overtly, but it's certainly implied, or it certainly might be in the mind of the patient that that's one of the reasons they want it. And I think the fact that one can see it as beautiful, which I certainly do, and I've certainly come to see my spine as having all these wonderful curves that people with straight spines don't have. And it's very graceful, and it's very flowing, and it's full of movement. And, I really enjoy, I've spent now 30 or 40 years. I can't do the math right now. I'm making art about it. But I think that's definitely not the general point of view. So
Want to talk about these two a little bit?
again, I mean, I think the one on the left, a lot of times I would do, once I had the 3D scan and I was drawing, I could draw my figure in all these different poses. I would often do, like, I would draw the figure from the outside. And by the way, another reason, it's not just about the visual, but it's about the kinesthetic and the proprioceptive, my own feelings of my body from the inside out, so I think that's why, that's the connection between all of this work. I think it's all about connecting with those feelings from in the body and then making them visual, but it's not just about the visual, So the one on the left is, it's actually a large detail of it drawing that I later also made, a version where you can see my rib cage and pelvis in the same pose. But somehow there was something about the colors and the forms and everything, and the way my hand was on my back, that to me kind of implies a lot about pain, which has been an ongoing issue for me, ever since then. And something else that I explore in my work, let's say. And the one on the right is another one, a more complicated one that I made based on the 3D scan. I think this was possibly a slightly later one where I had the more detailed scan. And again, I would plan the pose ahead of time, maybe even work on a photograph, but then I could just keep looking in the mirror or taking the pose again, feeling it in my body to feel where where I felt my muscles, where the bending, where the motion was, where the pain might be, all as much as I could to connect with my own feelings from within my body and then express that through the drawing.
Did you go to art school? Did you take a lot of life drawing before?
I did not go to art school. I always loved art, but I didn't think I could draw that well. I ended up becoming a graphic designer, where I kind of honed my drawing skills just from, we didn't have computers then, so it was like drawing a lot of type and making it, doing layouts and making them look very as if they were type. But it was only when I really started falling in love with the skeleton and wanting to draw and drawing from the skeleton, and just felt so motivated to be able to do that, that I just kind of started going to life drawing and really working on my drawing skills. And gradually, I think of it as kind of a learning through drawing process. Part of coming to know the anatomy for me was coming to be a better artist. And it's something that I brought later to my anatomy drawing class as a teacher, knowing that you can learn to draw yourself just by doing it, and that a lot of it is just by looking and seeing and then thinking about how you can translate that into.
So this question, well, I'm going to start with you, Laura, and then it goes to both you guys. So the painting on actually, these are graphite drawings. What are we looking at here?
Well, yeah, we haven't talked about my process. I do this kind of complicated. I do this two-step process. The first is I float oil paints on water and print those images onto paper. And a lot of what you're seeing in the background, that kind of floaty, organic kind of imagery, comes from that. And then that's the piece of paper I'm starting to do my drawing on. So I matched that sheet, that I've already done. I matched to the pose that I want to draw on, where the movement is and the colors and the sense of, where the figure will fit in. And then I draw with charcoal and pastel pencil and oil crayon, drawing media on top of the oil paint underlayers.
So the image, especially the one on the right, and you and I talked about this a little bit the other day, it's kind of there's a lot of sensuality, there's somebody holding you, and a lot of times people don't equate disability or disfigurement or something with sexuality and people even having sex or people. So I want you to talk about that, and then also, Mark, if you could talk about, does that come up when you're talking to teenagers, and like, is that part of something you have to talk about, sort of the sexuality of having an illness like this?
I mean, I think it's definitely about sexuality, and it's also about sensuality, which is how I always think of it. It's just that feeling of, I think sexuality and sensuality are probably where you feel the most connected to your inner body. If you do at all, that's the place where you do. And especially feeling connected to the body of someone else. certainly for me, in sex, that happens, the feeling that you lose track of the boundaries of your own body and the other person's body, and it all becomes very connected. So I think that's one reason that I wanted to, I wanted to imbue that feeling into my work, because my work is it's not about scoliosis, and it's not even about anatomy. It's about the feelings of the body and how they express themselves in a visual form. So that was very important to me. And then also, I think, this visual form of embracing arms, where you see my body and then you see embracing arms or touching hands, that became my way of kind of just bringing in the idea of, relationship, acceptance from someone else, the feeling that if someone else is touching my spine, they're accepting my scoliosis, my, protruding rib, what's called the rib hump, and my protruding rib cage, which is the part that would be considered, very deforming and ugly, but accepting it and finding it beautiful and desirable. And then, I think in some cases it kind of stands in for all the relationships I have, and very much so relationship with the doctors, because they've been a big part of my life. They play a big role in all of this, even in reality or in my own thinking. And this was kind of a way of maybe finding some kind of reconciliation. I certainly felt a whole different relationship to doctors once I started interacting with them as an artist rather than a patient, and having the medical images made. Also, that show that Ted and I were in together was the American Academy of Orthopedic Surgeons. They decided to put out a call for entries for a show about orthopedics and art. And that's where we met, and we met a lot of other really interesting artists. And I met a lot of orthopedic surgeons that way, which turned out to be great for me. I got access to be able to go and draw in the anatomy lab at another medical school in New York at Weill Cornell, and have some interesting interactions and have some questions answered, and actually to be surprised that orthopedic surgeons found my work really interesting too, because I probably thought it was going to be the patients but not the doctors who would like my work, but a lot of the surgeons really liked it too. So over the years, I've come to have a much different understanding of orthopedic surgeons and medicine in general, and that's how I ended up becoming artist in residence at NYU School of Medicine. But all of this was part of that, and I think these, the image of my body with hands, I mean, that's not so much today anymore. Now it's all about statistics and computers and everything, but I think the laying on of hands, or the interaction of the doctor's hands with the patient, was always a big part of it.
Mark, let's talk about that for a second, because I do work about scars, and a lot of times I'm the first person to touch their scar. And Laura was talking about not everybody touches her spine, or so you probably are putting hands on places on people's body that are not normally, like, they have to really trust you to do this. This isn't like, listening to someone's lungs with a stethoscope.
That's true, and I think that it's a big privilege to have that. And I will say one thing, it was touched on before. I think that part of it is, you asked the question about how do we address like a lot of the issues and questions that a teenager might have about whether it be sexuality or all the other things. One of the things that's probably changed a lot, I think I even saw it just from the time I was going through my training in med school versus now as an attending, we're really focused on education. A lot of times when you go to the doctor now, he doesn't just listen to your lungs, or do a knee reflex and prescribe a medicine or an x-ray and then you're gone. There's actually a lot more time spent discussing the condition, answering questions about the problems typically. So one of the biggest things, I get a lot of patients with scoliosis, and even though I do lay on hands and palpate the curvature and do side bending and forward bending and do the musculoskeletal exam, a lot of it is spent just answering the questions of the concerned parents and even the patient, who is usually, like Laura probably was, but wasn't probably at that time either allowed, or it just didn't get to ask many questions of the doctors, at least not get them answered. So so now I spend a whole chunk of time answering questions from the parents, and then I definitely make a point to go to ask the patient, say, to see if she has any questions, and really go through all of those questions, because there's just a lot of concerns on the patient, that things that she may not even, the patient may not have even brought those up to the parents, questions that the parents are thinking, it's my child, this is a medical thing, but the patient may have a whole different set of questions about it.
Okay. All right, we're gonna continue with some art here. Oh, there we go. So, Laura, why don't you talk about these for a sec?
Well, so after I had the second 3D scan in 2008, I got the idea of trying to have having a show at NYU Medical Center where I'd had the scan. And I got connected with some people in the medical humanities there, and it ended up that I proposed an artist residency. And that's when I became, became artist in residence, that I've been doing ever since. And that gave me access to the main project of my artist residency is a drawing class that I teach, an anatomy drawing class in the anatomy lab. And for me, it was actually the opportunity to spend a lot of time in the anatomy lab and do a lot of drawing and have access to not just skeletons, but all the anatomy. So I had always been really interested in, because as I've talked about a lot before, the whole idea of feelings of the body, I had always been very interested in the nerves and the nervous system and the spinal cord, as opposed to just the spine itself. And so I found an opportunity to start exploring all of that. And, I can talk more about the class or more about my work, or a little of both if you want. But basically these drawings, these are actually somewhat more recent drawings. The one on the right is actually a detail of a long, narrow drawing that probably wouldn't fit on the screen here. You wouldn't be able to see much of it, but it was, I used my 3D scan itself, which you can see a little bit of, the ribs and the pelvis here, actually from my 3D scan itself. And then I drew the spinal cord in great detail. It took me about a year to figure it out. We did some of the med students did some special dissections for me of the cadavers in the anatomy lab, so I could look at the spinal nerves as they came out from between the vertebrae. And, just trying to figure out what a curving spinal cord with my particular curvature would look like, and where the nerves would start to branch out to as they came out. And so this was the first drawing, that I made of my spinal cord. And it was just from the straightforward posterior view, because that was, it was so complicated to start with. That was really, I didn't even dare to venture into anything more complicated, And now the one on the left is one that I just made in the past few months. And, now having learned a lot of the anatomy and being more familiar with the spinal cord, I'm trying to get into more details to try to show, really the rotation, and also to show it in the context of my whole figure, with the embracing hands that I was talking about before. The one here on the left is actually, the next one that I did after the posterior spinal scroll one that I just was mentioning, where I started to go, into a more interesting point of view, rotated and turned, and to try to show where the nerves were coming out from. Here you can't actually see the cord, but you see the lumbar spinal nerves coming out from the openings between the vertebrae. And, I just find this imagery, I love the combination of the bones and the nerves somehow. And then I love, the sense of movement and the sense of, thinking about the movement that the nerves imply. They imply all that sensory input and the movement and, everything that nerves do, going back and forth between the, through the spine, between the brain and the body. So this has been my project these last, certainly 8 years or so, even more, since I had access to the anatomy lab. And yeah, the one on the right.
Sorry.
I had but I was kind of show, kind of the opening into the spinal canal, because some of the more recent drawings I'm doing now, it's like, looking down into the spinal canal or looking into the space, showing as much of the vertebrae as you would see, but, being able to look in on the spinal cord in its protective space inside the spine. This was actually a very early one that I did in the anatomy lab. Just the first time I saw a dissection of the spinal cord, where they opened up the spinal cord, a laminectomy. And I got to see, this is the cauda equina, where you see the individual nerves, branching off, and the spinal ganglia. And I just kind of started drawing it right on the spot. And it was just one of those rare drawings that just comes really easily and doesn't take too long. And it's really a good one, So I've always really prized this one. And, I'm always just like drawing just my own body. It's the same thing in the anatomy lab, just focusing on the one cadaver that I'm looking at, or the one spinal cord that I'm looking at. I want to really show the individuality of it. And it's almost like a portrait of that particular, in this case, spinal cord, to make you kind of think about in general how amazing they all are, and how different they all are, and how particular they all are to ourselves.
All right. So I was looking at the timeline of your pictures, and then Doctor, maybe you can talk about this in reference to people taking charge of their own care. So your pictures started sort of full body, and then over time they went sort of more in depth, more internal, smaller details. At least that's the way they look chronologically, your paintings. And I was thinking of how patients sometimes have to learn about their condition. I know you've had this condition for a long time, so maybe doctor can talk about this first. Sort of the difference from when people go in to when they start learning about their own care. And I don't know, I just think the way her paintings flowed, there's sort of a story there of somebody burrowing into their body and what's going on.
Well, it is. I'll comment. I mean, the detail and the is just phenomenal. I'm just, that's really amazing work, Laura. I really am impressed, just to tell you that. I thought you would have been a medical artist for your entire life just to get that how good that is. So the fact that you did this as just in being inspired by your own condition is really amazing. I mean, as a surgeon who does surgery, and as I'm working, I need to know where every nerve and all the anatomical aspects are. That's how I do my work. I have that in my mind when I'm doing it. Even when I see the skin in my mind, I can see the nerves, the tissues, all the things that you've painted. But could I draw it? No. I mean, the skill to have the vision to do it, and then also put it on paper as artistically as you have, I'm just want to laud you for that. It's amazing. But I think people, and probably Laura would feel this way, when most people have this discovered that they have scoliosis, it's weird. They've had it, but they just one day they look in the mirror, or their mom sees them, changing into a swimsuit, and they're like, what's going on here? And then it's this pretty significant curvature that didn't just turn out that way, but it just one day, a young girl or boy sees it, and that's when it's discovered, and it was never in their brain to even have something like that. I mean, it's pretty overwhelming, I think, for people to have that. And then, at first you're probably in shock. I mean, I'm the surgeon, I'm the doctor, so I'd love to hear what Laura actually says about it. But the first thing is to say, okay, what is this? What causes it? What do I need to do tomorrow or next week? Or what's, you're just doing basic information. But then over the years, obviously Laura took an interest in it and really got down to the level where not only did she make drawings, but she went in the lab and drew it to such a level that even anatomy students probably don't appreciate that level of detail about the nerve roots, the ganglion, the, you know, how it's innervated. There's a lumbosacral plexus that the nerves reconnect going through the sacrum. I mean, to have that uh, level of detail and accurate detail, I'm just really impressed.
Can I chime in here?
Sure.
Yeah.
Yeah, I mean, I'm thrilled to hear that. I think it's always important for me from the beginning when I first started drawing from my x-rays. I always was like, I want an orthopedic surgeon to be able to look at this and not see any mistakes, you know, at the very least. And it's wonderful to hear that you think it's so accurate. I also felt like as I was trying to learn at all different levels as I went along, I always thought I would learn by looking at what orthopedic surgeons look at when they're learning. But I found out that wasn't really true. I mean, I guess you guys learn by doing surgeries. You learn the visuals by seeing them in surgeries, because I wanted to look at, you know, the skeletons with curving spines that you guys looked at to learn about them. There really weren't any, or there weren't any that were available, you know. The images in books even, you know, it was really hard to find any kind of images. Now, when I got interested in the curving spinal cord, you know, I really haven't found any images of curving spinal cords in people with scoliosis that show the detail of, you know, where the nerves branch out to. So I just think it's amazing that you can do it just by visualizing it in your head, you know, and having learned it through doing the surgeries. To me, that's incredible. And you know, I have to have something that I can look at to give me the basic references.
So we have about 10 minutes left. If anybody has questions, they can either chime in or text chat in. So while we're waiting, let's see if anybody does that. I want to talk a little bit about, you do a lot of life drawing at your school. And what do your students get from your life drawing classes? And if, in the meantime, if anybody has any questions, send them in.
Sorry, yeah, we do. My art and anatomy class is a series of 8 sessions per semester, and only one of them is life drawing. The rest are anatomy drawing. So we're actually drawing from bones, skeletons, cadavers. And we bring in a life model for one session so that, because I want people to make that connection between the anatomy and the body that it's in, you know, and to see it in movement and to think about it as not just, you know, I think when you're learning anatomy as a med student, it's all about the normal and the abnormal, the pathological versus the normal, you know, but anatomy is just part of our bodies, and whether or not there's anything wrong with us, or even if there's something wrong with us that doesn't necessarily need medical intervention, like some mild scoliosis, you know, I think relate
Laura,
to.
I'm sorry. Other Laura wanted to ask a question.
Yeah, it was really terrific and interesting and enlightening and inspirational too. A great combination. I want to go back to something you said earlier, which I've heard from other patients of mine who have had early onset disabilities, which is the impact of their early experiences with the medical system and with physicians later on in their life. You know, that I've heard people say, I felt like I was treated like an object. People like talked about me. I felt like I was just sort of a specimen. And it really impacted the rest of their lives. And so I was wondering what advice you might have for students and for practicing physicians such as myself regarding what we ought to be more aware of.
I really appreciate that question, and I have an answer that, you know, something that I feel really strongly about, which is just, you know, as doctors, you really have to hurt your patients in order to heal them or help them sometimes. And even things you might do that don't seem hurtful to you, that might be hurtful to them, you know. And the most important thing, it seems to me, is just to acknowledge that, just to say, you know, I'm sorry I have to hurt you, or does this hurt you? You know, no one ever said that to me. And I've had doctors say things to me like, why are you crying? Or why are you upset? But they don't really want to hear the answer. It's more like, just what's wrong with you? You know, I think just for both parties, not just for the patient, but for the doctor too, like being able to acknowledge that this is going on would just be such a major help, you know. And a change in the way, the interaction takes place. Thank you for asking that. I hope that's a helpful answer.
So we have two other things. First, Melissa wanted to know if we do art anatomy, and we have not been doing drawing art anatomy. We've been doing life drawing through the Keck Art Club, and we do a couple sessions of that a year, so you can connect with them if you want, but maybe Pam and I can, or excuse me, Dr. Schaff and I can figure out a way to do an actual anatomy class. I've always wanted to do one down with actual cadavers, but at the moment, with COVID, we can't all get in a small room like that. So also someone's commented on your X-ray that they thought it was really beautiful, and the inclusion of the jewelry. So let's get back to that you've come to find that curve so beautiful, and you're showing it there. And what was the mental process to get to that point, or did it never bother you?
It's not that it never bothered me, but I don't know. I don't think I ever thought it was that ugly. I just felt that it might bother other people. Maybe that was the thing. I never knew how other people saw me, if they even noticed it or not. And if they did, was it disturbing or did it make them uncomfortable? And, it was when I finally started trying to find out, by asking people or talking about it, that it became much easier for me to just realize that, no, it didn't really bother people. And if I saw beauty in it, I could just see the beauty in it. I don't think, I never had to get over feeling that it was so ugly, or, finding a way to come to terms with it in that sense, And I guess, I don't know, a lot of people, not everyone, but a lot of people who have scoliosis have hypermobility and tend to be very curvy, which I fall into that category, that I found out when I worked with my dance anatomy neuromuscular trainer. She told me that I had hypermobility. That's another possible cause of scoliosis, because maybe your muscles aren't all holding your ligaments aren't holding your bones together as well as they should. But just being a curvy person and then having a curvy spine seem to go so well together, But I don't think it just applies to scoliosis or just to curvy spines. I think any anomaly, any kind of unusual anatomy, everything has its good side and its bad sides. And I think if we can kind of find the creative side, let's put it that way, the creative side, and focus on that, it just makes it better, and also just making it more part of the whole. I guess that's the main thing, to find a way to make it. I mean, if a beautiful curve makes me feel that it's more part of the whole me, for someone else, it might just be a more functional or a more straight or a more whatever, something else. But it's just like making it feel part of your whole self instead of just this part that doesn't work and everything else is, the real you.
So, Dr. Schaff, you have a question?
A comment, actually. I was just thinking, and in light of Dr. Mosqueda's question, I think one of the things that struck me as I've listened to your story and seen your work, I'm thinking in a whole new way about the patients in my practice who have scoliosis, and I'm wondering if Dr. Spoonamore is thinking the same way. But I find, I hope that I do a good job of listening and talking with the teen as well as their parent, but I feel as if your work could really help me help them. And, one of the things I think I'm going to do is share this recording with this family and say, here's something I think might be of interest to you. And I'm wondering if if any in your travels, if you've been asked to share your work in any way with patients, if they've sought you out, how has that worked? Because I find this to be, I feel like I've just gotten a new tool for practicing medicine, frankly.
It's very, very wonderful to hear that. I think, that's always been sort of my underlying purpose, or I can't even say purpose, but my hope, I guess, that my work could have an effect on how patients see their own bodies and then how the medical world, perceives them and interacts with them. And that's a lot of my anatomy drawing class. It's kind of all about how you relate to anatomy a different way just by drawing it and coming to see it differently, And yes, I would be thrilled. I mean, I've given talks for actually 2 orthopedic surgeons and 2 patient groups. But I think by becoming artist in residence at the medical school, I just ended up focusing a lot of my interacting with medical students and hoping that they would maybe learn to see a little differently and then go out into the world and see their patients a little differently, But it's definitely, I think it would be wonderful if, if that could start to happen. And if this talk can help, I'm gonna definitely hope that people will see it also.
Thank you. Thanks a lot.
All right, well, I think we're down to about our last minute here. So I will thank you. And then if Dr. Schaff has some closing comments, thank both you guys. This was I really enjoyed hearing what you both had to say.
Yes.
And Dr. Schaff, I just say also Laura's work is online on the HEAL page if you want to go back and look at any of this work.
Yeah, well, thank you so much. Dr. Spoonamore, thank you for being here. It's great to have you. Great to see you again. And Laura, thank you. And I really am just like doubly indebted to you because I love this, the fact that we have Ted as artist in residence because you were the first to fill this role at a medical school. So, so great for all of us. Thank you so much.
Yeah.
Thanks to all of you for coming today.